All right, it is 2:30, so I will get us started. Thank you everyone for joining us today. We are here to discuss visuals in health communications and share insights to help you more effectively use visuals in your work. My name is Katie McKay, and I'm joined by my colleagues Olivia Olson and Janelle Shu. I'm a project manager, and Olivia and Janelle are both health communication researchers. We all work at Communicate Health, which is a health communication and research company, and we take an equity-centered approach to create health information and digital tools that are easy for audiences to understand and use. So today we'll be talking about visual aids, specifically to meet 4 objectives. You can go to the next slide, Janelle. And we're going to talk about why visuals matter for health literacy, share insights from audience research, reflect on how visuals matter for health equity, and share tips for what to do when considering visuals used in health communications. And I also want to note that we'll be integrating our discussions of health equity throughout our talk today. And we've highlighted particularly relevant slides with this green heart that you see up in the upper right-hand corner. And with that, I will pass it to Janelle. You're on mute, Janelle.
There we go. Thanks so much, Katie. It's really nice to be here to talk about visuals. I want to start by having us take a step back and have a reflection activity. So I'm going to show you 2 images, and we're focusing a lot on images today. One, because they are kind of the basic building block for a lot of health communications, and because focusing on this kind of simple starting point is a good way to really get at the idea of some of the complexities of visual communication. So I'm going to show you 2 images, and for each one, I would like for you to respond in chat if you'd like, responding to 2 questions. Okay, here's the first image. So I'm going to give you a moment, and I'd like for you to respond. And in particular, if you could respond to when, if at all, you might choose to use this image in a health education material. So maybe what health topic, what audience. I'm seeing a lot of sports, motivation. I think that's really neat, just kind of getting at the emotion here, exercise. Yeah. Anything I might be missing it, anything around a specific audience, if any, who might your priority audience be? White men, people of resources to attend classes. Here's a question, is maybe it's too many unrelated factors, maybe we wouldn't use it, same age group, gym membership, so gotcha, that's really helpful. Now I would like for you all to share any things, if any, things that might make you give pause before using this picture in a health education material. I'm seeing some things like unrealistic, unattainable, not inclusive, kind of reinforcing social norms about the way men are supposed to look, very limited to limited to very fit men. So we're talking here about the person. I'm also seeing things about a detail that I hadn't considered before, which is the earbuds. And actually, now that you mention it, I have tripped myself up when I'm wearing earphones that are plugged in. So that's a great point. Talking about how this implies themes around money. There are some assumptions here. Ableism, Hollywoodized. I think that's a really effective term. Great. I'm going to have you all kind of keep these thoughts in your head as we move on throughout our discussion today. And then we'll kind of come back to this activity at the end. But before we move on to the main gist of our content today, here's our second image for you to respond to. So again, first off, I'd like to see some responses for what kind of material you would use this image, if at all. Medication management, pharmacy, samples of strategies, reminder. Do people know what this is? It's a good question. And I'm catching things as they're going. I'm not catching everybody's, obviously. Here's one I think that raises a really good point is, like most things in our work, it depends on the objectives and where it's going to be used, who the audience is going to be. In terms of audience, who do you think this might be for? Anyone who takes medication, English speakers, older, caregivers, health workers, English patient who can open it easily. We're getting into some accessibility. Travelers, that's a neat nuance. Might alienate younger because maybe it kind of projects that it's only relevant for older folks. Awesome. And also anyone. Alrighty, so what about any reservations or second thoughts you might have before using this, if any? You mentioned a couple of them. Language, I think that's a big one. Yeah, that's a good point, is this can be effective depending upon how many pills you have. It's not easy to open. Visual acuity, it's a little blurry, isn't it? Health literacy, there are 2 S's. So we kind of assume that people think of the calendar in this way. It does draw attention for the 2 T's as well, yeah. Assumes people know it's for meds. Looks dated. So you all are raising a lot of things about visuals that we're going to talk about today. Is first of all, why they matter. We're going to talk some about tone, some about purpose, some about audiences. But before we go into that, I want to set the stage a little bit by discussing why visuals matter for health literacy. So thank you, everyone. I really appreciate all that you're sharing on chat. Somebody's mentioning context here, so I want to give you some context. So why visuals matter for health literacy? One of the things that's really important to remember is that as people who are professionals in the health or medical related fields who are interested in health literacy, there's a growing recognition that organizations and professionals have a lot of responsibility to kind of meet people where they're at and to provide health information, health education in ways that are understandable, that align with health literacy best practices. So this is organizational communication. And HHS really kind of went in Healthy People 2030, redefined organizational literacy and updated it, especially to emphasize the importance of organizations and what we need to be doing as professionals, and also emphasizing how all of this impacts equity. That our ultimate goal here is not to just help people access, use, and understand and use health information, but everyone, and have it be actionable and address health equity issues. So I want to kind of lay the groundwork and talk a little bit about the whole process of vision and seeing, so that we have a better understanding of why we're making some recommendations later, why some of the studies we conducted, why we found certain findings. So how vision works. A lot of vision takes place in the occipital lobe at the back of the brain, but actually there's research to support that it involves all 4 lobes of the brain. It connects to memory, it connects to perception, and it also connects to attention. Like, so what part of an image are you looking at? What image are you looking at? Maybe among a plethora of other images. And one of the things that's tricky for us to really grasp is how quickly the process of vision takes place. There was an MIT study recently that found that with as little as exposure time as 13 milliseconds, participants could recognize that they saw an image when they saw it again later. And so think about that. If potentially we can process it well enough to remember we saw it in 13 milliseconds, think about how much visual information we're taking in at a time, and all the work that goes into making sure we're not overwhelmed, that we can stand upright, that we don't get headaches, that we can focus and try to actually make meaning of what we're seeing. This also means that there's a lot more to seeing than just vision, right? And seeing is a really complex process. It's your eyes working with your optical nerves, which run through both hemispheres of the brain. And really, it happens mostly in your brain. And I really like this quote for 2 reasons. First of all, it's a part of the image, or the visual is just a part of what our brain sees. So it's like the starting point, and then our brain adds on layers of perception and meaning. So as it says here, it's really our brains that are seeing. And importantly, what that means, and this happens a lot in communication when we're talking about text and audio, it's the same thing for visuals. The meaning that somebody takes away from a visual, the way that they're seeing the visual may not match up with the way we mean for that visual to be seen, for the meaning that we're wanting the visual to convey. And what this means a lot of times is that we need to start from a place of trying to identify what assumptions we're making and really being open to when might this image be good to use, what are aspects of this image that work for my purposes, and also what's some trickiness that I need to think about. What aspects of the image might be interpreted, might be seen in a different way, and perhaps in a way that ends in unintended consequences. So communicating is obviously a complex process, and unlike reading and even language, where we're kind of familiar with how people get from being a baby and they can't read to they grow up and there are different strategies for teaching them how to read. Before that, when they're babies, they don't understand language, but they gradually begin to copy it, to accurately understand it, and then to vocalize. And there's a tons of research, and even some of us have had professional training about those processes. But with vision, what's funny is it happens automatically. A baby is able to see from when they're born. Now their field of vision is more limited at the beginning, but they're already from the get-go processing information. And so that's something we sometimes lose track of in health communications, that it's not just about the words that we're using. Now, those are super important, but they're not everything. And I think most professionals that I've met have had little, if any, professional training on visual literacy, visual communication, graphic design, any professional training related to the strategic and thoughtful use of visuals, much less how to do that in a way that promotes health equity, that helps to address health inequities. So that's what we're trying to do here today, is I've been talking about why visuals matter, and now I'm going to turn it over to Olivia, who's going to be sharing some neat insights. We get really excited about them when we're doing research, insights from audience research studies that have kind of reinforced some major things to think about when you're choosing visuals. Olivia?
Yeah, thanks, Janelle. You can go to the next slide here. But next, we'll be sharing some high-level audience research insights from recent studies we've conducted at Communicate Health. Specifically, we're drawing findings from studies where we've explored how images and materials can enhance or hinder understanding. For the most part, these were small qualitative studies with a variety of participants, most of whom had limited health literacy skills as measured on our screeners. And we're happy to answer any additional questions about our methods after the presentation as well. You can go to the next slide here. Findings from multiple studies have indicated that, as expected, an image can help capture attention and really draw in the audience. For example, in several studies, some participants noted that including images in health materials had an impact on whether they perceived a material as easy to read. Participants said it really helped with the layout and breaking up the text in a material. Participants in multiple studies indicated that they also weren't as interested in engaging with the material if it didn't include any images. This quote we have here from one research participant really highlights the importance of images to draw in the reader and catch their attention. Next slide. In several studies, findings also highlight how visuals can make materials feel more inclusive. For example, one participant in a study said, "I'm a very visual learner myself, so it helps me see how I might be able to use it and what the parts of the pen or the syringe are." It's important to note, though, that this is more than just about preferences. From a health equity perspective, including images and materials is especially important for meeting the needs of individuals who rely on images because they can't readily read and understand text. For example, people with limited literacy skills or limited English fluency, or people with dyslexia and other language disorders that affect a person's ability to understand and interpret written content. So in this way, images can really help in efforts to address health inequities. Findings from multiple studies indicate that it's also important for images to clearly connect to the main message of a material to help with understanding. For example, in one study where the material's main message was preventing lead poisoning in children, some study participants said that they preferred an image that illustrated the main message by providing an example of what a lead poisoning hazard looked like on a window frame. And we have this quote from one research participant here that really emphasized that point. Findings from multiple studies also support one common reason that health communicators often include images, which is to clarify who the priority audience is. For example, in one study, we included this image on a different version of that same material about preventing lead poisoning in children. And some participants said they preferred this image because it helped them understand who the material is for. It helped them understand that it's for parents, that it's for families with children. This quote here also further highlights the importance of including diversity within your intended priority audience, which we'll talk a little bit more about later on. Findings from some studies also show that there can be unintended consequences of images, which is that they can cause confusion. It's the one reason why we find it so important to conduct material testing to really ensure that images aren't causing confusion or even harm. For example, in one study that tested an image of a gay couple for a material about HIV prevention, the image caused confusion for who could or couldn't get HIV and made participants question their accurate understanding of HIV. This image choice here had a backfire effect of actually reinforcing stereotypes and myths about this health topic. Findings from multiple studies also support what we'd expect. When it comes to selecting an image for a material, people like to see people. For many studies, participants indicated that adding that human element is important because it makes the material feel relatable. Participants also said that images of people can sometimes be more appealing than images of objects because they can see themselves in the images and it draws them in more. This example of a material here illustrates another finding from several studies, which is that participants said they like to see images of more than one person and images that reflect more than one priority audience, if applicable. Findings from multiple studies have also indicated that it's important for images of people to show a diverse array of lived experiences. That is, images that show everyday life, like a family gathering for a meal, with a variety of different people who look like the people they might know. In other words, real audiences can find it difficult to relate to the models or the people in those cheesy stock photos. Several studies also highlight an important nuance, that it's important to show diversity within the priority audience. A study that looked at campaign materials for Black and African American adults found that including images of Black and African American adults doesn't automatically make the material resonate with all members of that priority audience. Findings indicate it's essential to show different family structures, skin tones, hair types, gender expressions, etc. And we could provide so many more examples from our research, but hopefully this gives you a sense of how images that are carefully chosen and preferably tested with the priority audience can help address health inequities. One reason that it's important to test messages is also to guard against health communications contributing to health inequity. While having a diverse representation of people and images can be tricky, it's extremely important in order for the priority audience to feel seen, to help draw them into a health communication material. Findings from various studies indicate that images of people also have the power to reinforce stereotypes and harmful myths about a health topic. For example, this was demonstrated earlier with that image of a gay couple that accidentally reinforced a harmful myth about HIV. So, how do you represent your priority audience without perpetuating stereotypes or stigma? Besides testing, a very important strategy is to work closely with the people from the audience you're trying to reach. Not only does this help you in developing more effective materials and products, it also contributes to health equity when you work with and build relationships with the people you're trying to support. Another key point about images that emerge in our research is that tone, or in other words, the light and color of an image, can really make your health communication materials more or less effective. In numerous studies, participants frequently noted that images that were brighter, had a positive tone, and appeared more inviting, drew them in, and made the material easier to read. In one study, a research participant shared that bright colors made the material resonate emotionally with her. On the flip side here, studies indicate that images with a darker shadow can negatively impact the viewers and make them less interested in engaging with a material. In one study, some participants said that images that were darker made the material feel scary or sad and really impacted their interest in wanting to read the material. This quote from one research study participant does a great job highlighting this finding. So when selecting an image, it's really important to consider not only what the image shows, but also how aspects of the image itself, like lighting and shadow and color composition, can make people feel. And with that, I'm going to hand it next to Katie to share some tips for effectively using visuals.
Thanks, Olivia. So yeah, now I'm going to distill down what we've been discussing so far into a handful of tips with some examples for using visuals in health communications. So our first tip is to use them. As we just highlighted, including visuals makes a big difference for whether people feel a material is relevant to them or whether they read it at all. Sometimes professionals, especially those who don't have a design team or background in design, may shy away from including images and other visuals because they don't know what to include. And so the following tips will help us figure out exactly how to do that. And you can see an example here of a designed fact sheet with visual aids versus one without. So our next tip is to include people's faces. This helps connect with priority audiences and humanize calls to action or behavior change. Like Olivia mentioned, our research shows that participants really like the human element, and people's brains are actually primed to hone in on human faces. So here in this example, you can see an example of an image where you show faces and where you don't. Our next tip is to use images or visuals that support the main message. This helps audiences make connections between visuals and the material, and also contributes to understanding and building stronger health literacy skills. Visuals also help make materials more actionable, and actionable health materials are an essential part of health equity. Non-specific health images don't help the audience and might in fact make it harder to engage your audience because it doesn't help them understand the material. So you can see here an example, say this was a fact sheet about healthy eating. You have an image that's related to that versus a generic health image that isn't really related to the topic and doesn't contribute to understanding. The next tip is to, tip 4, Janelle. Reflect the priority audience. If your material is intended for a specific population, make sure that they're seen in the visuals. As we noted before, engaging people from the community that you're trying to reach is a great way to more effectively reflect your priority audience and contribute to health equity as you do so. So if you could go to the example, Janelle. So say you had a material for where the audience is folks with disabilities. You would make sure you want to reflect those audiences in your materials. You can see that here in this example. Which leads me into tip 5, which is to include more than one photo where possible. You heard in Olivia's section about the potential to reinforce stereotypes or even provide misinformation. And so including more than one visual helps reflect diversity, avoids perpetuating those stereotypes, and you can address all your audiences without needing to do that all in one picture, which is sort of impossible. So you can see here we have an example with one photo versus one where you have multiple photos. It adds visual interest as well as lets you see a different audience. Our next tip is to use a consistent style. And this really helps audiences make connections and is a health literacy best practice. It also adds to visual appeal and is just easier for folks to read and digest. So if you go to the example, Janelle, you can see here you have a consistent style. You're using a person versus something that has a different style across. Tip 7 is to avoid triggering visuals. And this could look a lot of different ways based on what the material is. But there are certain things like needles and blood, for example, that might be hard for people to see or turn them off from a material. So instead, you can show the intended outcome or behavior. For example, here we have a person who received a vaccine versus them getting the vaccine itself, where there's a photo of a needle. And tip 8 is to get audience feedback. As the communication environment becomes more complex, it's really essential to get audience feedback. And you can see how much of an impact this has from the research findings that Olivia shared earlier. even if you don't have the resources to do a big research project, which I know can be a barrier for a lot of us, you can learn a lot when you get input, even from just a handful of people. Whenever we get audience feedback, we invariably get insights that help us to create health education materials, websites, and other communications that are effective and contribute to health equity. So in this example here, you see before testing, this is a website, and this was a mock-up that was tested. And then after testing, if you want to bring that up, Janelle, it looks pretty similar, but you can see at a glance how much audience testing helped us refine this website and what visuals to use. All right, and so I will now pass it to Janelle.
Thank you all so much. I really appreciate getting into the details of the research. We do a lot of audience research, and it's always really interesting and fun, frankly, to get insights that you weren't expecting that help you think about your materials in a different way. And the tips are primarily designed to be the starting point, but obviously this is a much bigger conversation. So many things go into what images, if you're using images, much less what visuals you'll be using. And some of the factors that are especially important that we've touched on, relate to cognitive, physical or mental disabilities or challenges, relate to social determinants of health, including racism, and to individuals' personal and cultural backgrounds. And so it's really hard to balance all those. But the first step is really thinking about needing to balance those. And working with communities that you're trying to reach and getting audience feedback are just so important, not just for you contributing to health equity, but also to changing the structures that support health inequities, that create health inequities. I want to come back now with all that in mind. I want to come back to the images that we saw at the beginning. And y'all were touching on a lot of these things when we started off this presentation. So for each of you, I would love to hear something that you didn't think about when you first looked at these images. Maybe a nuance that was new to you, or a different side of something that you are already aware of when you're looking at these images. So first of all, we have this image. In chat, if you can go ahead and share out when, if at all, you think you would use this image, like what health topic, what audience. Not sure I would use it. I think that's a great place to start. Seeing a lot of people that if it's a for-profit health company, that it might match what their communication goals are. Tech company, I think that's really interesting. Seeing things about getting audience feedback. If I was marketing a health product or gym, but not in patient education. So here's a different question for you. What image might you use instead? Would you change up this image, like get a different version of this one? Or what would you use as a substitute, if you will? And feel free to share assumptions that you might be thinking about. Whatever you might be picturing. Outdoor activities. Use a cartoon. Different people. Different ages, different forms of physical activity. Yeah, I know for the Move Your Way campaign through HHS, different kinds of physical activity was super important, and everything from designing the logo to all their materials. Having a diverse group of people, diverse in many ways. Location, age, body type. Yeah, sometimes people don't feel comfortable working out in front of others. So really thinking about what you're trying to get out of your communication and figuring out what image or other visual would make the most sense to support that communication goal. Alrighty, now here is the second image again. So when, if at all, would you use this image in a health education material? Like what topic, what audience? I'm seeing never. A lot of medication management. Medication adherence. Giving an example of what a pill bottle can look like. Put pills in the image to give it a little more context. Maybe showing folks using it. Especially from your priority audience. Instructions on how to use it. Yeah, really thinking about I was going to say there's nothing really wrong with this image, but also the yellow is a nice bright color, but for some reason the background looks too flat or something. But I feel like the tone might be a little bit better with some better lighting, just as it is. But yeah, putting people in and showing it in context, I think would be a minimum for really helping to support a communication goal around medication management, adherence, a how-to, whatever your goal might be. Make the background light up. That's a good point. More modern styles. And that, again, I think depends on who your audience is. But one thing that we also have to think about is assumptions we might be making, stereotypes. We use this in a material. It was an experiment that we were doing, so we specifically chose this one. And one of the things people said is, oh, for older folks, but older folks is a really big group. And a lot of them identify with more modern aesthetic as well. So even there, just really thinking about who specifically you're trying to reach and the variety of those peoples. All right, awesome. I am going to go ahead and hand this back to Katie for this last section, and then we'll end with some Q&A. I'm skimming through some of the questions you've been asking, and we have reserved plenty of time to talk through some and answer some of these questions.
Thanks, Janelle. So you can go to the next slide, and I will share some key takeaways from our session today. First, using visuals effectively is a key part of organizational health literacy. Visuals can impact understanding, engagement, and relevance for priority audiences. Consistent and thoughtful consideration of visual aids for health communication supports health equity. And whenever possible, get feedback from your priority audience. And so with that, we'd love to use the rest of our session for a Q&A. I know that we've seen quite a few in the chat, and we have some in the Q&A section as well. The first one that I know folks were talking about, are there good resources for where to get stock images? I saw some people give examples in the chat, so thank you so much for that. And I do want to name that can definitely be a barrier, both in terms of cost, appropriate use for copyright versus privacy, things like that, as well as, unfortunately, a lot of the stock images we have access to aren't diverse. A lot of white people, able-bodied people, things like that. So yeah, thank you for sharing those resources in the chat. I don't know if Janelle or Olivia, you have any additional resources. I saw the ones I saw folks share already.
Yeah, that's a really good point. In that some of the ones we used are in the chat, but Katie, I don't know if you just want to briefly type in a few. I know that you've worked on this on several projects. But one thing also I want to point out is you're right, that it's a resource issue. And that's one reason why the focus on organizational health literacy is so important. Is it's not just about professionals, but it has to also be about organizations supporting training and helping, if not financial resources, so you have a graphic designer or so you can purchase photos. If not those resources, then helping employees to connect with others so that they can share resources, right? So that we can share the love in terms of accessing, finding free or at low cost images of people who don't look like what a lot of stock photos are, you know, which are not representative of, frankly, most people. Probably even the people themselves who are the models. I have a feeling it's not really representative of them either. Yes, we can absolutely do that. We can scroll through the chat and kind of consolidate some of this collaboration and sharing that I am talking about. I'm going to go ahead and if you want to, the Slack or the chat is going so quickly that I've missed some of the questions, but if you want to put them in the little Q&A like nodule in Zoom, I can address them, kind of go through those now. The first one was from Julie McKinney, and I briefly responded to it. She was talking about how a lot of the images are happy, carefree, and how do you kind of do tone when you're talking about issues that people are not happy about. And that's a really important consideration. And the short answer is that it's about empathy. We have found sometimes that a picture of somebody looking miserable, like they have a bad cold, that can be really effective for conveying empathy, maybe for health education material in an urgent care, right? Those people, a lot of them parents, certainly don't want to be like, they're not wanting to be there for a variety of reasons. And in testing, they responded really well. So I think it's less, the examples I can see kind of implied happy, good, not happy, bad, but I think it's more about, is it conveying the tone that will support your communication goal? One thing I'm wondering about is a couple of questions around digital visuals. What are some best practices for communicating the purpose of the visual in contributing to understanding of the resources? So this is around alt text. And Katie or Olivia, I don't know if you can find, I'm pretty sure we had a We Heart Health Literacy post around alt text. But yeah, there are some best practices, and a lot of it involves balancing out the length of your alt text with text that actually supports the main message. So this ties a little bit to your image. If your image is more clearly supportive of the main message, then when you describe that image, you'll likely be getting the alt text that you need. So alt text, obviously along the lines of a bunch of apples, maybe isn't super supportive of a healthy eating, healthy nutrition, health education material, where if you describe like, a pile of fresh apples, even that freshness helps to kind of get at an aspect that makes that a healthy choice. Some of the tips we've shared seem to run counter to some of the web writing best practices I've seen, which is that stock photos often get ignored or get in the way and frustrate users. Are there different considerations for web writing? This was really interesting because a lot of the principles of plain language text are the same. And with visuals, I would say the general guidance is the same in that you need to consider each material separately. So there may be some general guidelines about reducing the number of visuals, but not about getting rid of them entirely. And sometimes stock photos, you're right, they might not be the right visual to support. So it's about bearing that in mind as you're developing your website, your microsite, whatever your digital product is, thinking about how that will look on a desktop computer, on a tablet, on a mobile device, and going through those iterations to see how it impacts the usability and perceived readability. So a lot of this comes back to, I see you cite Norman Nielsen, like user testing, right? Let me know if, for any of these questions, if you'd like to discuss further. Where do we get our images? Katie is compiling that. Do you have best practices to share around testing materials with audiences, providing incentives for people's time and expertise or other considerations? The answer is yes, I have lots of them. I may follow up with you directly if you want to just Slack me your email address, and we'll share out our email addresses at the end. Actually, Katie, I don't know if you want to do that now in the Slack, if you wouldn't mind. We're happy to answer any questions, but incentives are tricky. It depends. There are kind of guidelines that you're beholden to, depending upon if you're a government organization. There are some more strict guidelines if, as we recommend, aligning yourself with institutional review board and human subjects research. You don't want to have incentives that's so huge that somebody feels like they can't say no. And obviously, you don't want an incentive that's not going to incentivize. So it depends on who your audience is, but at the same time, we try and have equity. Like with our consumers, we generally try, and it doesn't matter who the consumer is, we're going to give them the same incentive. Same thing with professionals, is trying to have equity. And one thing in research is around incentives that's really interesting is that sometimes $1 is enough. Sometimes free food is enough to show somebody that you appreciate their time and input. Most of the time, I want to say, and Olivia, you can help me out there, I think it's around 75 to 125, depending upon how long the session is for like a typical everyday consumer. Other considerations, a lot of it is qualitative research tends to work best. If you want to have a chance to dig into it, and that can be materials testing, message testing, online or in person. I'm so excited to do in-person research again. It can also be combined with usability testing. And just also remember that this research, you're not trying to come away with themes that you can generalize, like that you would say, okay, I did this research and here are the key themes that are important to consider. What you're doing is trying to make the material work, right? Trying to make it effective. So if you're identifying problems, even if only one person has a problem, like we were talking about the man who questioned his accurate understanding of who can get HIV, which is anyone, that's a really important kind of red flag consideration. So even if we only heard it from one person. So that's just something to bear in mind. The type of research we do is more like development, not to kind of add to a more generalizable understanding of the world. Pros and cons of photos versus drawings or graphics. That's a really good point. The one of the cartoons that we showed you in here was an image from a storybook, an online storybook that we worked with the CDC to create for people with intellectual and developmental disorders. And they crafted those characters based upon real people that they met, and based upon data about some of the health issues that they face. Somebody mentioned earlier, and I'll come back to the cartoon aspect, but somebody mentioned earlier, it can be really hard to represent invisible disabilities, because lots of times wheelchairs are one of the only things. And I think in that regard, is it more about they need to say, oh, that's a disabled person, but also like when they're disabled, like what feelings may be are they really struggling with? And if you can convey that, even if you can't see the disability, what you're conveying is that they're not able, they're not getting what they need, perhaps. But that is tricky, and ultimately it depends on what type of disability, lots of times. So you can show a little bit of a variety. In terms of the drawing, in that case, we specifically chose a storyboard because that really worked with a priority audience who had an extremely low literacy level, who liked stories in that format. So in that case, a cartoon really supported our communication goal. And I think sometimes like drawings or graphics, other kind of graphics, cartoons, you'll have the same considerations, right? How are people responding to it? How are they interpreting it? And does it match the tone, right? Does it convey the diversity of people? And sometimes you can get around that, but do we really want to? It's hard to say. I will say here that one thing we did not talk about, because that's a huge, big, tricky thing that a ton of academic researchers and practitioners are working on right now, is data visualization. Data visualization, they can be really great when you need one and when it actually supports your goal. Oh my gosh, we're out of time. I'm going to go ahead. Here are some resources. And Katie, I don't know, did you have a chance? Did you have a chance to share out our contact information?
Yep, I put it in the chat.
Okay, so for those of you who don't know, you can actually save the chat, which I'm going to do. So I can reference it later on, but feel free to email us. And yes, that's a great question about surveys. So will this resource slide be shared? Yes. It is part of our presentation and the slides. Okay. We can work with IHA to figure out how to communicate our answers back to you. Let's think about it that way. Thank you so much, everyone. I'm sorry we're a couple minutes over. I lost track of time and got really excited. Thank you all so much. You were so engaged. I really appreciate it.